Hello, Staten Island, and welcome to another edition of Together SI. My name is Todd Bavona, reporting for the Staten Island Advance, and today's spotlight is going to be on Dr. Thomas Bottiglieri, who is the Assistant Professor of Community Medicine and Orthopedics at New York Presbyterian Columbia Doctors. I think I got that right, Doc?
Yes, Todd. Perfect.
It's a long time. I didn't want to mess that up. Thanks so much for joining us. Doc, we're going to talk about three topics today in regards to the coronavirus, COVID-19. First off, symptoms. What should one really look out for when it comes to symptoms, and then go to their physician?
The recommendation for people at this time is headache, fever, shortness of breath or cough. You need to check in with your primary care doctor. Fortunately, lots of telehealth networks have been established where you can call into a doctor, have a video visit, review your symptoms, review your risk factors, even more importantly. So people over the age of 60, diabetes, hypertension, pre-existing pulmonary disease are at greater risk and should be tested so that we can anticipate if we're going to need more critical care for those particular individuals. But if you have the typical symptoms, headache, fever, cough, and body aches, chills, rigors are going along with that, definitely get in touch with your primary care physician, figure out risk stratification based on your medical history and whether or not you need to get in for a test.
Reduce the spread has been the theme for quite some time now. Doc, can you talk to the preventative measures that we can take, from social distancing to, if we do need to go out, wearing masks? And the local government has told us to be wearing masks when we go out in public now. Go over the preventative measures that we can all take.
So, the biggest risk factor in this country has proven to be obesity. And my particular passion in terms of exercise is medicine. Now's a good time as any to get outdoors, get some fresh air, and go on a walk, plus or minus your surgical mask if you can't maintain 6 feet of distance from your neighbors and other people out on trails where you're walking. As far as other things you should be doing, eating healthy, lots of fruits and vegetables, stay hydrated, and get adequate sleep. Inadequate sleep can suppress your immune system. And if you overdo it with exercise, that can also suppress your immune system. But now's as good a time as any to develop good habits. Stop smoking. New York City Quits is a helpline, and just focus on the measures of health that are mostly common sense in terms of good nutrition, rest, and light exercise.
Doc, last question there. Talking about good news that we're trying to see, we're at a stage where we seem to be, the curve, as we refer to it, seems to be plateauing or on the decline. What other good news has been out there in regards to all this in the health world, and what you've seen around the public? Because I know you've been having to go to work doing what you do. What's some good news you can shed some light on, Doc?
I think the feeling that I have right now is similar to the feeling we had after the tragedy in 9/11, when communities came together, people were willing to listen to each other, be creative, come up with new solutions. And in our orthopedic department, we've done everything remotely at Columbia, and our meetings are well attended. We're able to provide education to residents and students. We're getting things done in a remote environment. And I think that's true of all businesses right now. People are figuring out how to get things done. Telecommuting is a new term that everybody's using. And I think that if something positive can come out of this, maybe we'll figure out a way to reduce the burden on commuting and transportation, and maybe even reduce air pollution. I don't know, that's a stretch, but I think that we've proven that we can do more from home than we thought we could, even including education for our kids. So that being said, we also realize how important it is to socialize with friends and neighbors and family. And if nothing else, maybe we all have a deeper sense of appreciation in this moment.
Well, great point. Yes. And a great point with earlier what you said with staying healthy, be smart about everything. So Dr. Bottiglieri, thanks so much for the time. Appreciate it.
Thank you. Be well, be safe, Todd.
All right, Doc, thanks. We appreciate his time. And thank you for taking the time to watch Together SI, another episode where we place the spotlight on someone from our local community on Staten Island. My name is Todd Bavona, reporting for the Staten Island Advance. Take care.